Hi, so my name is Parag Sayal. I'm a consultant neurosurgeon. I specialize in complex spine surgery. So although I'm a neurosurgeon, but my specialism within that is complex spinal surgery, which is the entire range of spine surgery. I'm the clinical lead for complex spine surgery at Queen Square, which is the National Hospital for Neurology and Neurosurgery. So my education in complex spine surgery allows me to do a range of spinal procedures, neurosurgical and orthopedic. So a lot of spine surgeons may be neurosurgically trained or orthopedically trained, whereas I've got dual training in orthopedic spine surgery and spinal neurosurgery, which sort of gives me a well-rounded approach to doing this. I do obviously the simple spinal surgeries, which are the bread and butter of spinal surgery, like decompression surgeries, all the spinal tumors, whether they're metastatic spinal tumors or spinal cord tumors, intra-dural tumors. But basically the entire range from, I would say, from head down to the pelvis, the entire range of spinal surgery. One thing that I very particularly have developed in the last 4 or 5 years as a service is the CSF leak service, which there are many patients who get leaks, spinal fluid leaks spontaneously. These patients have been neglected for years, not because someone wanted to neglect them, but it's a very difficult to understand and treat condition. And we've developed that here at the National Hospital for Neurology and Neurosurgery as a big area of specialism. So I actually spend quite a few minutes in the beginning of my consultation not even talking about their problem. I talk about their life, what they've done in their life, what they hope to achieve out of it, what is it that drives them. Because at the end of the day, my job and responsibility is not just to help their pain or their problem, but to get them in a place where they can get back to doing all the things that they love. So my approach to my patients is not just based on being a very hard, rigid, science-based. Of course, I should do that, but and I know people say you should, as a doctor, detach yourself from the emotions of it, but you shouldn't. There should be a little bit of that so that you actually understand what your patient's kind of going through, and what can you get them to, but also treating your patient not as a patient, but actually as a person who has a stake in the decision making, is proper stakeholder, involving them in the decision making, giving them information in small packages so that they can digest it, giving them time to understand and to come back to me to ask the relevant questions, and not treating questions as a difficulty or a problem. In fact, welcoming questions, welcoming challenges from the patients. If my patient challenges me with saying, right, why can't you do this? Why can't not taking that as a negative, but taking that as a positive and involving them. So that's my approach to my patients.